Assalamu alaikum and welcome to Health is Wealth. Today we will be talking about asthma. Asthma affects 5.4 million people in the UK, which means 1 in every 5 households is affected. For many people, which is about 250,000 people with severe asthma, even climbing a flight of stairs can seem like a marathon. Another very shocking statistic is that every day nearly 3 people die because of asthma, but these deaths could have been prevented. With me in the studio today, I have Caroline Stead, who is a community pharmacist and has counselled many patients on asthma and how to use their inhalers. Welcome to the show, Caroline.
Hello, Nadia.
Hi, nice to meet you. So, what is asthma?
Asthma is a long-term condition that has symptoms such as coughing, wheezing and breathlessness. So what happens is the small tubes in your lungs become inflamed and that they narrow, so it makes it harder for you to breathe. An asthma attack or an exacerbation is where those symptoms become a lot worse. And it's said that every 10 seconds somebody somewhere is having an asthma attack in the UK.
10 seconds?
Every 10 seconds.
Gosh.
So, as you said, like 3 people per day die due to asthma. And the current statistics show that almost 90% of those can be prevented with proper treatment.
Really? So how can asthma be prevented then?
Well, we can't prevent an individual from getting asthma in the first place because we don't know exactly what it is that causes it. There's a genetic link there. So if your parents have an atopic condition, an atopic condition is an allergic condition such as hay fever, eczema.
So you're more at risk then?
You are more at risk, and if you yourself have that, you are more at risk of having asthma as well.
Right.
There are also environmental triggers, so smoking is a risk factor, and children who are exposed to cigarette smoke and children of mothers who smoked as well are at more risk of developing asthma.
Really?
Also, if they had a low birth weight and needed ventilating when they were a baby, that sort of damage to the lungs early on can then develop to asthma in later life.
Goodness, right. So how is asthma usually treated? I mean, you probably see lots of patients coming to your pharmacy and, you have to advise them. So what sort of kind of treatments do you see? How is it usually treated?
Usually it's a twofold treatment stream. So we relieve the symptoms and we then look to prevent those symptoms happening again. So you would usually have a reliever inhaler, which is usually a blue inhaler. It's not always, but it's usually blue. And a preventer inhaler is usually brown or orange or red.
Is there any sort of way we should be using this, or do you use them both at the same time, or do you use one before the other? Is there any sort of any sort of prescriptive way of using these inhalers?
Okay, so the reliever is there to give you immediate relief of the symptoms of coughing, wheeziness, breathlessness. The preventer is there to be used day in, day out to prevent you from getting that to that point.
Oh, okay. So, can we stop asthma from getting any worse? Because, I mean, I've seen definitely in my experience with patients, they're not only on just 2 inhalers, they might be on 2 or 3, or they might be on some tablets as well. So the asthma must have got worse. What makes asthma get worse?
I think the key thing is to make sure that you're taking your inhalers as prescribed by your GP or asthma nurse. I think most cases where that treatments are added on are down to inhalers not being used properly. So if you're not using your preventer as you should be and your symptoms are getting worse, then that's the first thing you should look at is, are you using your inhaler as you should be?
So it's a lot to do with inhaler use and inhaler technique. So asthma attacks as well, that's another big issue. What should you do if you have an attack?
My first piece of advice is probably the last one you'll consider. Don't panic.
Right.
But you will, because you can't breathe.
Of course.
So you need to be prepared for if that's going to happen. So you need to carry your reliever, your blue inhaler with you. If you have an attack, take your blue inhaler, take 2 breaths as prescribed of your blue inhaler, sit down and breathe deeply. Okay. If that doesn't work, if it's still you feel unwell, you can then take 2 more breaths, and you can continue to do that every 2 minutes until you stop feeling well, or you've had a total of 10 breaths. If you still feel unwell after that, call 999.
Right. And that's more of a serious issue then.
So your blue inhaler is not getting you under control.
Right.
But that's why the emergency services are there for you at that point.
So the most important thing to sort of note is that you should carry your blue inhaler with you at all times.
Absolutely, because sometimes you may be triggered by something that you're not aware of, that you're not expecting, that and you need to be always prepared for that.
So how can we monitor asthma at home?
Well, as I mentioned before, every asthmatic should have an asthma care plan, and it should tell you on that exactly how to treat and monitor your asthma.
Yeah.
I do have here a peak flow meter.
Oh, you've come very well prepared, haven't you?
Yes, I have, yeah. Okay, so everybody who has the care plan should know their best peak flow. So this peak flow value, it varies very much between people. So it depends on the age, height, weight of the person, and also it varies very differently between men and women. Okay, so advice on that you should get from your asthma nurse or your GP.
Of course, yeah.
Okay, so it's very easy to use. So you slide the marker right to the bottom, you hold it steady, and then you give a breath out as hard as you can. And then you get your reading. Mine was 500, so that's actually today is very good. One of my best ever peak flow readings.
Well done to you, Caroline. I noticed here that you've got a few other gadgets and devices. Would you mind
yeah. I thought
us?
I'd bring along a few inhalers to show you. So these are just some of the many devices that there are out there, and more are coming onto the market. They mainly come in 2 forms. So those that are activated by your own breath, and those that are device activated. You also have those that have a propellant, and those that are dry powdered.
Right, what's the difference? Or
there's a difference in how you use them, and how it feels when you use them.
Right.
But in terms of the drugs, no.
Right.
There's no difference in those.
Brilliant.
Okay, so if I just show you, this is the most common type, and this is called a multi-dose inhaler. It's a CFC free, and if you just you can see it comes out, and you spray it, and you get a spray. Okay, so with this you need to coordinate your breath in with spraying it.
Right. So would you mind showing us?
I will show you.
That's very kind of you.
This is actually my own inhaler, so I'm quite happy to show you. So the important thing is that you shake before you use. That makes sure all the drug is dispersed within the container evenly. You make a seal around the mouthpiece. Then you press the canister down and breathe deeply in. Not sharply, a natural breath, but a deep breath. So, like this.
And there we can see Caroline's actually holding her breath for 10 seconds now to ensure that the drug is reaching her lungs properly. She obviously couldn't speak at that point.
Thank you, Nadia. Yeah, and that is really important. So it's really important that you don't take a sharp breath so it doesn't hit the back of your throat, but you take a deep breath so it gets right into your lungs, and you hold your breath so that the drug has time to settle in your lungs as well. Okay, this is a powder one.
Okay. That looks quite significantly different to an inhaler.
It is, and it doesn't really look like a traditional type of inhaler. So you load it by opening it, and you take a sharp breath in, and that's to make sure that all the powder comes out and is deposited in your lungs. Again, you need to take a 10-second breath. I won't do so this time. There's no drug in this one. Okay.
And then you need to hold for 10 seconds.
You can see the difference. That breath has to be harder to.
So what if you find it difficult to use an inhaler? I mean, there are many patient groups, say for example, patients with rheumatoid arthritis, the whole coordination, you know, bringing down the canister might be quite difficult for them. So what can they do then? How could they, you know, how can you ensure they get the most out of their medicine?
Well, the important thing is to have a conversation either with your pharmacist, who know an awful lot about how to use all these devices, your asthma nurse or your GP. If you are struggling to use it or you're not certain how to use it, then go and speak to one of those people and they will show you. If you have a problem, a physical problem, or your problem coordinated, there are devices.
Oh, fantastic.
So this is called a spacer device. And this is great for if you have problems with your coordination, or sometimes, especially with the preventer inhalers, they can cause some side effects with having a fungal infection in the mouth. So if you're having problems with that, a spacer device can help prevent that as well. So again, you shake the inhaler. These are for the aerosol ones. That goes in snugly in there like that. You take your cap off there, you make the seal around there, you spray, one spray.
Right, so there's no coordination required there, you just breathe normally.
And you would do that 10 times.
Right.
That is so much easier than trying to
Coordinate the pushing down. Yeah.
Pushing it down, breathing in.
Yeah.
It makes the whole thing quite much simpler.
Yeah, you could actually tell the difference between when you use the inhaler and then when you put it on the spacer. It looked so much more easier.
The other thing is, if you use this while you're having an asthma attack with your reliever as well, it helps you coordinate your breathing a lot easier and it calms you down. So it helps you to be able to coordinate that in-out breathing, because you're concentrating on breathing in and out, and that helps to regulate that and relieve those symptoms.
That's brilliant. Well, thank you very much for coming to the show, Caroline, today, and, you know, bringing all the devices and actually educating us on how to use our inhalers properly. So thank you.
Thank you, Nadia.
Asthma affects 1 in every 5 households in the UK. And as Stead said before, that on a daily basis, 3 deaths occur because of asthma. And these deaths could have been prevented. Using your inhalers properly can be one of these preventative measures. So if you're unsure on how to use your inhalers, please visit your pharmacist so that they can advise you and show you how you can use your inhalers effectively. We hope you got a lot of information from this show and hope you enjoyed the show. Now it's time for our fitness segment with our personal trainer. Assalamu alaikum.
Assalamu alaikum wa rahmatullahi wa barakatuh. It's very normal during Ramadan to feel very low of energy. That's not so much because you're not eating, it's more because you're dehydrated, you're not getting enough to drink, and especially when the days are really, really hot. Now, if you're sitting in an office and you're feeling low of energy, there are some simple stretches you can do to get a little boost of energy during those days. I'm going to show you 3 of them today. The first one is very simple, stretching the neck. So you're just gonna lean your head to one side and gently pull it down towards your shoulder and relax the opposite shoulder as much as you can. Hold the stretch there for about 30 seconds and release and do it again on the other side. The second stretch is for your pecs and for your thoracic spine. So the first one starts off with stretching of the upper back, the thoracic spine. You push as far out as you can. You may even want to change hands and pull the other arm as well out a little bit. The next one is for your pec, and you simply stretch your arms as far back behind you as possible until you feel the stretch. These stretches you should hold for about 30 seconds each, both ways. The last one I'm going to show you is just for a rotation of the spine, to keep your spine moving so it won't stiffen up. You use your chair, your office chair, and you hold as you try and rotate your body backwards. Now, some may be more flexible than others. Go to where you're comfortable and do it on the other side. All of these stretches can be done at your desk. You don't have to leave and you don't have to stop your work. You just do it for 2 minutes and you're done.